Welcome to Back from the Abyss. This is a place for stories of hope and healing, recovery and redemption. I'm Dr. Craig Heacock. Today's story is yet another by a therapist who reached out to me. This is a vulnerable and profound wounded healer story, a story of trauma and coping and resilience and healing. I think that if you know a therapist, you know someone who's been through some serious shit. Maybe it was their own psychological or psychiatric suffering, or maybe it was a family member or both, but no one goes into mental health without their own backstory. A unique twist to today's story is that I've known Kristen for almost 20 years. We used to work together. But in recent years, I've had very little contact with her. Then she reached out to me about telling her story, and I came to realize that the stories and beliefs I had about her had been dead wrong. That I had been projecting my own beliefs and interpretations onto her, but I had no idea who she really was, why she interacted with the world and with me the way that she did. And now, 20 years later, Kristen and I come full circle, for her to sit down with me and share this story, and for me to rewrite the story I used to have about her, to see who she was and now is from a lens of compassion and connection, not one of judgment and intimidation.
Sometimes I think the very best place is to start at the beginning. And for me, my story really starts at the very, very beginning. So I really grew up with this sense that I was a mistake. And that started from the moment of my birth, actually the moment of conception. But my mantra in my life for so long of my defining childhood and teenage years and young adulthood was this concept of I'm a mistake, I'm bad, I'm dirty, I'm evil. And so much of my journey has been trying to get past or really let go of that belief about myself, that I'm a mistake, I'm bad, I'm dirty, I'm evil. So where that mistake comes in from and where that really came from is my mom was on birth control when I was born or when I was conceived. And what she always told me and what she said was that I was a mistake. She followed it up with the best mistake I ever made. But as a child, all I heard was I was a mistake. I was born at 26 weeks. And when I was born, she had gone into preterm labor. And she went into the hospital and the doctor said to her, well, clearly you miscalculated your dates. So they induced her. So then I was born at 26 weeks. So there was this concept of, okay, my conception was a mistake, and then my birth was a mistake. So it was like that right there just really did shape my existence. Part of my story is I'm the youngest of three. I have an older sister that's 3 years older than me and an older sister that's 2 years older than me. And my parents got divorced when I was 2. So they got divorced, and my sisters and I would go to my biological father's house for weekends and holidays and summer visits, of course. And it was during that time that there was incest, that there was sexual abuse that was happening. And that went on until I stopped going to my father's house. And that was when I was 12 or 13 years old. Here is this horrible, awful truth that's happening, but yet how do I hide it in a way that nobody knows that? How do I keep myself and my family safe by being this perfect little version of me where nobody sees what's happening? Well, yet there's all this other stuff that's happening. So as I went along and had this mantra of myself, here I am, this mistake, this bad, this dirty, this evil child, what do I need to do to compensate for that? So it's like I became this little robot, basically, that was existing in the world, that was trying to figure out what my place was. And yet all of these learnings that are coming in, that's just making everything so much more difficult and so much harder. I think when we talk about the impact of those, key developmental years and all the trauma that was happening, is I really learned that this world is not a safe place and that I needed to do everything that I could to keep myself safe, but to make sure that everybody else was happy and that their needs were taken care of. As I've already discussed, I had this mantra of this, like, I'm a mistake, I'm bad, I'm dirty, I'm evil. And really what I was really kind of grasping with is this concept that I am wrong and that I am unlovable, that I'm never going to be enough. I'm never going to be smart enough. I'm never going to be pretty enough. I'm never going to be skinny enough. I'm never going to be enough. Nothing that I do will ever be enough. I also learned that, my body wasn't my own, that there was something wrong with it. And my reality was also something that I couldn't trust. And I say that because, here's this horrible, awful thing that's happening on the weekends and holidays and all of that stuff. And then I'm going home to my primary house, which was with my mom and my stepdad. And the expectation was that we were the perfect family. That we went to church on Sundays and that we were upper middle class and we really had this image to keep up. And, as long as we all fit that image, then everything was okay. But here I was trying to figure out, how can this reality be true, which are these horrible things that are happening, but yet then I'm expected to really have this other reality. I think learning to live in those two separate spaces was kind of what shaped all of my struggles in my adulthood. Here I have these two very separate identities, and how long can I keep them going? And that exhaustion that comes from that. I developed bulimia when I was 11. I remember, for those of us of this age and generation that we are, there were all the teen magazines like Vogue and 17 and like Teen Bop and like all of this stuff. And so sad that they don't have any of those anymore. I guess the age of the internet. But I remember reading one of those teen magazines, and I was 11, and I read this story about eating disorders. And I read this story about this girl who ate, and then she made herself throw up. And I was like, oh my God, that's like the most amazing thing ever. Like I can eat and then throw up and not get fat. Because again, I already had this message that my body wasn't okay. That there was clearly something wrong with my body. So if I could keep my body a certain way, then maybe my body would be okay.
What an example of, I gave a talk the other day where I claimed that many psychiatric symptoms are contagious. And I said that eating disorders are often contagious. So you were reading this informational piece, memoir kind of thing, and you find, hey, this is a good idea.
Right. Yeah, absolutely. And I think that's what happens for a lot of people, because you even look at self-harm and cutting, and there's totally all of contagious. This idea of that. So yes, contagious in the trying it out, but then the suffering comes in when the trying it out becomes the thing that you have to do. So it's no longer a choice, but it's a need. And for me, the purging, that's what it became. It became the true need. I learned by purging that was the first time I had a voice, that the purging for me, and this, it's such a mixed thing, because of course it's silent, it's secretive. I mean, you can't make a lot of noise. You have to purge quietly because you don't want anybody to find out what you're doing. But purging for me was a way to scream. It was the only way I had a voice, so it was that act of vomiting, that act of that violent, body betrayal was like, oh, this feels so good. This is the thing that gives me power in all of the situations that felt so completely powerless. And my eating disorder stayed with me in the form of bulimia through my teens into my early 20s. And then the loathing, the body hate, the body shame, has continued on for so much of my adult life, and it's just over the past couple of years that I've really gotten to a good place with my body, which has been amazing. But that's what sexual trauma, that's what trauma does, is it just stays with you and it lives in your body. And there's all of this, again, go back to my mantra that I had of I'm a mistake, I'm bad, I'm dirty, I'm evil. My body is bad. My body is dirty. And the evil word is a little bit different, but it's like, oh, my body constantly betrays me. And if my body were okay, if my body were good, if my body were pure, then I wouldn't be betrayed. But my body is betraying me people have betrayed me. My abusers have betrayed me. And then I became the own betrayer of myself as well, and betraying my body because I felt like my body was betraying me on a regular basis. So that concept of, oof, gosh, there's just clearly something wrong with me. There's always been something wrong with me. There's something wrong with me. How do I move past that?
Yeah. So really your eating disorder came really directly out of the sexual abuse. Yeah.
Yeah, I think so. Well, it's not even I think so. I know so. That was my coping. That was the way that I survived. So this is the interesting thing that is kind of hard to wrap our minds around when we look at some of these behaviors that people do, and obviously the behaviors that I did, of here is this thing that's keeping me so sick. Here's this thing that I'm struggling with that's awful, that's so painful. It's that double-edged sword. Your eating disorder or addiction or, out of control behaviors, whatever they might be. It's like, oh gosh, I want more than anything to get rid of this. It's my best friend and my worst enemy, and that's where we really see it. And that's where I see it with clients. That's where I saw it with myself, of this push and pull of here's this thing that I want so desperately to be free of, but here's this thing that I'm holding on so tightly because this is what I need. This is my survival. So the eating disorder is a maladaptive coping skill, but yet I also look at the eating disorder as, oh, how smart was I?
Yeah.
How amazing is that here's a little 11-year-old that discovered this thing.
That helped.
Yeah. Yeah. That absolutely kept me sane, that kept me functioning, that kept me being able to meet all of these like societal pressures and requirements and all of that stuff, because I had this thing that was basically like my life vest.
Yeah. And I'm guessing like a lot of unhealthy coping strategies or even addictions, what's so helpful initially starts to turn on you.
Absolutely. And I feel like it really did turn on me in so many ways. It did. My eating disorder controlled my life. I had lost control of my own sense of identity, my own sense of self, where here was this thing that I felt like I had control over, but really it controlled me. The first time I ever admitted to anybody that I was struggling with this was this therapist I saw. First time I saw her, I was in 8th grade, so 13. Nobody knew about my eating disorder at that time, but I had run away from home and I left in the middle of the night. Oh my gosh, I'm a mom now. And I think about the torture I put my mom through at this point in time, and like, I have a lot of guilt over this, but
it sounds like you were not being seen. You're being incested, quote unquote, nobody knew. You had this horrific eating disorder, quote unquote, nobody knew. Like,
right.
You were invisible.
I was absolutely
totally
invisible.
Yeah.
Yes.
Unwanted, dirty, broken, and invisible.
Right. Yeah. Yep. So I ran away from home, left in the middle of the night, like in a blizzard in northwestern Pennsylvania, hitchhiked to a nearby town. I'm 13 years old and I'm out at like 4:00 in the morning hitchhiking to this town that's like 25 miles away to get on a bus to go to Buffalo, New York, which is like another 60 miles away from where we lived at that time. Anyway, I didn't stay away very long and I was found and taken back home, which was all fine. But as a result of that, that was the first time I think anybody really saw maybe there's something wrong with this girl. So they sent me to therapy. They, being my parents, sent me to therapy. And I had this therapist, and I can still picture her office, and I can still see her. She had the most beautiful blue eyes. But she was so kind. She was so kind. And that first time I was sitting in her office and she said to me, what brings you in, or like whatever us therapists say to people on that first session. And I kind of hemmed and hawed around things. And, And basically like I was saying, well, I've thought about doing some things that probably are a bad idea and my parents are really mad at me and, whatever. And she said the question, well, have you ever done any of those things? And I was like, well, I ran away from home. And she's like, you ran away from home? Like, tell me more about that. And it wasn't like this judgment. Like I didn't feel judgment from her. And I think that was the first time that I sat with an adult that I didn't feel judgment. It was like, okay, I can just say whatever I want to say. And she listened to me. So I consider her like a true lifeline, like a lifesaver for me. And I saw her throughout my high school career. I saw her for, several months at that time. And then, of course, I was a rebellious child and was like, I don't need to go back anymore. But then when I was that was 8th grade, when I was in 10th grade, my eating disorder was really out of control. And I told one of my friends. And my friend, she was wise beyond her years, basically said to me, you really need to see a therapist. So I contacted this therapist I had seen when I was in 8th grade. And amazingly, she basically just said to me, you know what, just come in and I'll see you and we'll figure out a way to tell your parents. So I went to see her and it was to her that I disclosed for the first time that I was making myself throw up. And again, there was no judgment. There was no shame. There was no like, what are you doing that's so gross or that's wrong or, no lecture or anything like that. Just this true kind of joining with me of it's okay to talk about these things. And she felt so safe. Like when I would go to her office, it just was this sense of safety. And I think about her being a real lifeline for me because, again, I saw her for a little while at that time. And then again, when I was a senior in high school, I went back to her and she really knew at that point in time the depths of the despair of my eating disorder and where things were.
But not about your sexual abuse.
No, not.
That was too.
Wasn't disclosing any of that. So what happened was my parents were going through a divorce. So I was 17, senior year in high school. My parents were going through a divorce. I lived in small town USA. Like I think now the town that I grew up in has a population of like 6,000. I mean, it's a really small town, farm community, like all of that stuff. And my parents were going through a divorce and my dad was having an affair. So there was this rumor that was going on that my dad was having an affair. And of course that was devastating, and like I felt like my world was being ripped apart even more. And I went into her and I said, like, I need help. Like I need something different. And she basically said to me, you know what? I think we should send you to residential. I think you need to get out of this town, especially while this is going on. Because small town USA, for anybody who's listening who knows what small town USA is like, everybody knows everything. There are no secrets. So she was the one who said, this is what needs to happen. I'm going to send you somewhere that you can get away from this, you can escape from this, and you can also do some healing. So when I was 17, I went from Pennsylvania to Arizona to a residential treatment center. And that was the first time that like I really felt like I could talk about my eating disorder. And that was also the first time that I could disclose some of my story about what was happening with the abuse. But as we know, so many people who start telling their story, they're just going to give a little tiny piece of that. They're not going to give the whole thing. So for me,
I think it's kind of like a tester plate.
Absolutely.
Because there's so much shame, everything, and secrecy. And it's almost like you finally find someone you can trust. You just open up this little piece. Like, what are you going to do with that?
Right. Let me dip my toe in the water and test the temperature before I dive fully in. And it took me, let's see, that was 17 when I went to residential for the first time. And it probably took me until I was 21, 22 before I fully disclosed the extent of some of the sexual trauma. So it was like I could live in that space for a while. And I think I had convinced myself, well, if people just know this little piece, then I can be doing all the work without having to disclose everything. But again, one of the things us therapists love to say is our secrets keep us sick. And that secret, that like keeping that, carrying that, really feeling that shame kept me so sick for so long that it was like, okay, at what point in time do I need to rip off the Band-Aid and like fully be like, yeah, this is what happened. this is what was done to me. This is what I survived. And then the empowerment that came from that of, oh, I can tell this story. I can actually speak these truths without having to feel like somebody's going to blame me or somebody's going to shame me or somebody's going to be like, yeah, clearly that's your fault. Because that was always my fear, that I would be, well, which is what abusers do, right? That, okay, the abuser's MO is, let me convince you that this is your fault, that you're bad. You know, again, going back to my mantra, I'm bad, I'm dirty, I'm evil. No, it's you that are all those things. It's not me that are all those things. So it took me quite a while to be able to even really speak those words. But once I started to, it was pretty empowering.
So at least in a couple key ways, going to residential treatment was really important for you.
Mm-hmm.
It sounds like it was the first time you can really begin to kind of open up and peel back those layers and share what had happened.
Yeah. Oh, and this is such a hard topic because residential, and yeah, even now as we're sitting here talking about this, like I just realized I just checked with my body, you know, and it's like I still have this body reaction to even starting to talk about this.
What's the reaction?
I think there's this like anxiety and this like real, like what I'm feeling in my body is this anxiety and this also like deep core, like, oh gosh, we don't say these things.
When listeners, for a visual here, Kristen is sort of slowly moving her hand over her neck and kind of up her chest in this sort of slow swirling way as she talks about anxiety, which makes me think it's really like caught in your throat and your esophagus and your upper chest.
Yeah. You know, it's really interesting. It wasn't until just a couple of years ago that I started to do some of my own work and healing around the trauma of residential, not just the healing, you know, and I think that's kind of where we're conditioned that mental health professionals and treatment are here to help us, and that obviously you and I are both in this field, like we're good people, like we have our client's best interest at heart, like all of that type of stuff. But then there is this darker side. And I think just like the abuse, for so long I was afraid to even own, okay, yes, residential was so helpful for me in so many ways, but has this really dark side as well that was hurtful in a lot of ways.
Do you feel like you can speak to that dark side?
I feel like I can now. And I'm, you know, again, checking in with my body because I think this is something that's so important that we are not taught to do, but really having a mind-body connection of what happens in your body as you're talking about hard things. So I'm like checking in with my body as I'm speaking as well. And when we talk about residential, or when I talk about my residential experience, it's one of those double-edged swords as well, because it was helpful. So I'll start with what the positives of residential are. So I went to, my first residential experience was when I was 17. I went to a very well-known, kind of the gold standard of eating disorder treatment at that time. And I was there for 6 weeks, and it was a very positive experience. But then, like a lot of people with eating disorders, with out-of-control behaviors, with addiction, I soon relapsed after I got out of residential, and then spent a couple more years in a state of relapse before I decided that, again, I needed to go back. I needed some more intensive intervention. So I went and I found a small residential program that I talked to the owner on the phone, felt really comfortable, like, okay, this is where I'm going to go. This is what's going to be helpful. It was in between my sophomore and junior year of college, so I was going for the summer. So my plan was to go, fix myself, another 6 weeks, fix myself, do all the things I needed to do, and then go back to college. But what happened was I went, and after 6 weeks, the residential staff was like, you're not ready. Like, you need longer. So I think you should stay longer. So, there was a lot of thought in that of, okay, what would that mean for me to delay college and like all of this stuff? But yeah, I really need this. I'm desperate to have healing at this point in time. Well, what started out as a 6 weeks residential plan ended up to be a 4.5 year residential plan. And I say 4.5 years, and that may sound like, holy shit, that's a really long time. I do also want to give some context that this is in the late 90s, which insurance was a little bit different. Treatment program lengths were a little bit different than they are now, all of this. But what was sold to me and my parents was 6 weeks of residential intensive, followed by a transitional type program, followed by halfway house living. So that's what I did. I did residential for as long as I needed, went into a transition living program, and then went into the halfway house. But how this came to be really a darker part of my story, and a part of my story that I don't normally talk about, is I really believe that there was so much high control in that residential program. And it was like, you fall in line and you fall in step with our thinking, our beliefs, and you'll get better. But if you don't, if you question anything that we say, if you don't 100% submit, then you're never going to get better. So you believe everything that we have to say. And if you don't, you're in denial. If you don't, it's your disease trying to control you. We know best. So it was like the facilitators of the program had themselves up on this pedestal that we are the thing that's going to fix you. And unless you can fall in line, then you're never going to get better. Well, I wanted so desperately to get better. So then here I am again in this situation, just like I was in as a child of, wait, this is not my reality. But people with more power than me are telling me that my reality is wrong. So there's this part of me that's like, I think I'm okay to go. Like, I think I'm actually doing better, but they're saying, no, I'm not. So then what does that mean? And when you think about residential culture, it also becomes a bidding war for attention amongst the clients. Who has the worst story? Who's the sickest? Who is most deserving of the attention? So it's like you go into residential and you might be really sick. And then like a couple months in, then you're really sick. And then what happens? How do you get yourself out of that? So that went on for a couple years. I was a quote unquote patient. And then I became a staff, because that's also what very like high control programs were doing at that time. Of you were a client and then you became a staff. And the way they build that or sold that is, look at us, how amazing we are. All of our staff, we can help you because we've been here. We understand like nobody else could ever understand that we get you. We understand you. And look at our success rate. Look at these staff members we now have who are in recovery, who are amazing. And yet we're all still like miserable in our lives and like struggling in all these ways.
It's like some kind of cult.
Absolutely.
It's like a church of the eating disorder.
Yes. Yeah. That's a really good way to say it. And for a long time, I was afraid to use that word cult, but I really think that that is what it feels like. That is what the experience is. And, I look at like my own ability and resiliency and ability to get out of that situation. And there are several key things that I can say, okay, this is what really helped me. This is how I got out of it. When I was a client, I remember I had a suicide attempt when I was at residential, and we'll talk about that in a minute because I think that's a really, really important part of my story. But I had a suicide attempt when I was in the halfway house, so I technically was a halfway house client. And then, of course, my suicide attempt led me to go like, oh, you need to go back into intensive residential. So this was like 1.5 years into my time at this treatment program. And I went back into residential, and there was this girl that I had been in residential with, and she had left, and she came back. And I remember seeing her, and I remember hearing that she was coming back and then seeing her. And this would have been her, like, I don't remember exactly. It was either her 11th or 12th stay in a residential treatment center. And I remember looking at her and saying to myself, I don't want this for my life. I don't want to be the girl who other clients are looking at going, oh my gosh, this is the 11th or 12th time you've come back. And some people need that, like 100%. I'm not shaming people who need that and really need that level of intensity. But I knew for me that that's not what I wanted, and that I had to actually make that decision. Do I want to recover and get out of this and change my life path, or do I want to keep doing this? And that really was a turning point for me. That was the turning point for me that made me say, okay, get your shit together and start actually doing the things that I know. Start using the skills and the tools that I've learned. Start putting myself as a priority. Start really owning, wait a second, there's more to life than this path that I'm currently on.
This is like the birth of your agency.
Right.
Like, okay, I actually can take the steering wheel of the bus of my life and do something with this.
Yeah, absolutely. Yeah. I've just shared quite a bit about the residential treatment. And as I said, obviously I was there for a very, very long time. But what had happened is I was living in the halfway house and I was lying through my teeth. I mean, I still was throwing up every day in the bathroom, like telling everybody I was doing great. Nobody knew what was happening because I was in the halfway house. I had like freedom to like leave. I was working a job, I was doing all this stuff. And as I said, still throwing up every day. And I had finally gotten honest. That was one of the things, like, when are you ever going to be honest? Are you going to be honest? So I'd finally gotten honest about the fact that I was still engaging in this behavior. And there was what they had, that this program had what they called intensives, and people from around the country would come for shortened periods of time, like 5 to 7 days. And it was like therapy from like 8 a.m., to 11 p.m. at night, like nonstop in the group room. And back then, like very confrontational too, like we're going to like confront all of your behaviors. We're not going to do it with like love and kindness and all this. We're going to like get in there and be really mean about it. And so I was in this intensive and the staff was doing what they did, which was like confront. And I remember just leaving and being like, I don't want to be here anymore. I don't want to be here. Like, I don't want to be in this space. I don't want to do this anymore. So I left the group and I, again, had a car, had privileges, all of that, and went to the store. And this was before I ever worked in an emergency room or knew anything medical or anything like that. So bought all of these things that I thought would end my life, and took a pretty massive overdose and thought that I would just go to sleep and never wake up, and then my life would be over. And that's what I did. And then I woke up. So then I was like, well, fuck, that didn't work. Well, I couldn't tell anybody that I did this because then I knew there were going to be consequences. Like I couldn't go to the staff and be like, I took an overdose. Like I just tried to pretend and like go about my business. And one of my roommates at that point,
how sadly ironic is that? You're in a treatment center.
Yeah.
You're in complete life-threatening distress, but like, I can't tell anybody because whatever, I'll lose privileges, lose levels, exactly. I'll be demoted, I'll be shamed, I'll have to wear a different colored jersey or give back my merit badges.
For sure. So, I mean, that's what I was going to do. And I should say I had done that several times earlier in my life. Like I had several, I now call them suicide gestures, not attempts, but gestures in my early teens. And that's what I would do. I'd take these pills or I would do something and then nothing would happen and I wouldn't tell anybody. So this was just a repeating of that same pattern. But this time it was bad enough where one of my roommates was like, okay, something is wrong with you. Like, what did you do? So what did you take? And then she asked me, like, what did you take? And all I needed was somebody to ask me again, because so much of my story is I was never seen. So like she saw me, she saw that something was wrong and she asked me and I told her. And I believe that would be so true in so many other instances in my life. Like if an adult had ever asked me as a child, is something going on? Is somebody hurting you? I probably would have told them. If somebody had asked me earlier in my life, in my early teens, hey, like I'm observing this weird bathroom behavior. Is there any chance you're throwing up? I would have told them at some points in time, maybe not always, but like, I think that really is important. Like ask the question, if somebody would have asked me questions, then that would have meant that they saw me and I could have been honest. So with the suicide attempt, as soon as she asked me, I told her, yes, I had taken an overdose, and then off to the ER I go. Well, this is a really important part of my story because it was that experience that basically shaped my professional career for the first, good portion of my profession. So I went to the ER. All the horrible things that come along with somebody going to the ER when you overdose, I charcoal and all the nastiness that comes with that. And I mean, my suicide attempt was serious enough that I spent about a week in ICU after that. But what I remember from the ER was, again, this residential facility I was in a small town in Texas. So they didn't have behavioral health workers in the emergency rooms like we do now. So what they had was they had a police officer come in. So here I am, 21 years old, just took this horrible overdose, felt horrible, vomiting charcoal everywhere, like this very bad experience. And this cop walks in and I felt like I was in trouble. Like here I was again, now I'm in trouble. I did something wrong. There's a police officer that's standing at the side of my bed. And I'm sure he was very kind and he was very nice. I'd like to think that that's what my memory is. But basically what I remember most is feeling like I was in trouble, and him basically saying to me like, well, why would you do something like this? Like there's other things that you could be doing, call us the next time you want to do something like this. And I thought to myself as a 21-year-old, like, why in the hell would I call the police? Absolutely not. So I remember being horrified, like so horrified that there was a part of me that once I was physically recovered and back to where I had my full like thinking capacity, thinking to myself, I never want anybody ever to feel that way again. So when I knew that I was going to go into the behavioral health field, I knew that that's what I wanted to do. I wanted to help people who were in that situation and to be able to be with them at their lowest of low and have them not feel like
in the ER in crisis.
In the ER in crisis. And not feel like they were a criminal or in trouble for what they just did. So that's what I did. I mean, for the first, when you and I knew each other, that's what I was doing. I made it my life's work. I made it my passion. I made it my mission to make sure that if anybody in a behavioral health crisis goes to an emergency room, that they're treated in a way that they should be treated, which is with compassion, with dignity, with respect, and that they're not shamed, and then they're not, convinced that they're in trouble. As the behavioral health provider in emergency rooms, how can we have that same level of compassion?
Tell me more about the decision to go to do the process of becoming a therapist, because I'm guessing there's part of you thinking, I've had amazing therapists like that one in high school. The treatment has helped you, that you have tons of experience with all this stuff. But then when you flip the coin, you have a ton of experience. I mean, you've been incested and terrible eating disorder and shamed and all this. So I would imagine there's part of you thinking, I'm going to be the perfect therapist. And part of you thinking there's no way I could do this because people are going to see right through me and see how damaged I am.
Yeah, when I started my journey to become a therapist, I thought that that's what I would do. Like I was convinced and really committed to working in eating disorder residential. That was my path. That was my plan. That's what I wanted to do. In grad school, I got a job at a local psychiatric inpatient facility, and part of my role there was to do assessments. And it was in that job that I learned, this is really what I'm good at. This is what I like. And never in my wildest dreams did I ever think at that moment in time that I would do private practice. I was like, please, no way. Like, I can't do that. I don't want to do that.
Do you think in part that was because at that point in your life, you weren't ready to do the emotional work and vulnerability that it takes to have, genuine, complex relationships over time? Like to have a private practice, like you have to be willing to put yourself out there emotionally. Whereas I could see in the ER, you could be very mission purpose focused. Like I'm going to make this a good experience, but I don't have to get kind of too messed up in these people's lives.
Right. Absolutely. That's what I loved about ER work more than anything. It's like I had to see you one time and then I didn't have to see you again. So like I could be everything you needed me to be. I could absolutely help you and take care of you for that 2-hour time period. And then I don't have to see you again. So that was part of what I loved. And that was part of why I think I thrived so much in that. But yes, there was so much of a struggle for me of becoming a therapist and feeling like, who am I? How could I possibly help somebody when I am still so broken? And that was a part of my story and still remains to be part of my story. I mean, there are still times where I still have this immense imposter syndrome. I'll be sitting with clients now and I'll be like, oh my gosh, I don't know what to do. Or I love it when my clients come in and they're so honest and they like lay it all out and tell me everything they're struggling with. And I'm like, you're so brave. You have so much courage. I could never do that. And that's part of my struggle that I've had for so long with even finding my own therapists of, here's this dialectic that I've had for all of these years of, I'm really good at my job. I am very competent. I am successful. I get shit done. I think about my career since I've been here in Colorado and, I've done some really incredible things. I've been at the head of some amazing projects that still are in our community. I've created some really incredible services that have served people in ways. And I'm very, very proud of the things that I've done. And I've had amazing teams and colleagues that have really poured their heart and soul into these projects and that have made these things so good. But I'm good at my job. Like I'm a good clinician.
And not only that, but when I think you and I have known each other for maybe 20 years, but my memory of you in the early days is like you were a little scary because you were so intense and so purpose driven and so confident and so this is what we have to do. I remember thinking like, wow, this Kristen woman, she's on fire, but she's a little intimidating. Like she's like, don't fuck with her. Like stay like this is her kingdom, and the ER assessment is like that is her baby, and don't. I remember being really impressed by you, but also like, ooh, even when you'd call like with people in the middle of the night to run by me, I'd be like, okay, I better like not get in an argument with her because I want Kristen to like me. But you were a little. I don't know if you can remember that, but I remember you kind of had this like badass persona, which is maybe your outer attempt to sort of compensate for what was inside, which is a lot of fear and insecurity and shame.
Absolutely. And that's what I was going to say is that's what trauma does, right? Here was this outside projection of like, I have to appear this way. So how can I go so far over to the other side? Like, correct. Like I can't have anybody, especially you as a psychiatrist, like you're a doctor and I'm a lowly social worker. How can I possibly like, I have to make sure that you see me in all the ways that I am professional and that I am competent.
See, I saw you as like a social worker ninja, and I was like a new psychiatrist, like golden retriever, like wag my tail, like, hey, do you like me? Can we be friends? And you're like, this is the way it's going to be. Like, okay, don't mess with her.
Yeah. And then now to hear me tell this story, like of all of this insecurity, like all of this, oh my gosh, like I am so broken. I cannot have anybody see that because then what would you think of me? Like what would my colleagues think of me?
Yeah.
If anybody knew the truth, if anybody knew my backstory, what would they think of me? So here it is. I just shared this story, right, of how I got into emergency room social work and why I'm so passionate about it. And I used to train all of my staff, and I would say this with 100% conviction. In the emergency room, that role that we had was the most important role out of all of the system. Because when those people came into the ER at their worst of worst, we were going to set the tone. If we were kind and compassionate, then we'd set the tone for their experience to be positive. But if we were bitchy and rude and like unprofessional, then they might write off mental health altogether because their first experience with a mental health provider was something that was negative.
You know, I've been joking with you, which is it's true that actually that I was pretty intimidated by you in the early years I knew you. But when you reached out to me about doing this, this story, you sent me this email. I was like, oh, look at Kristen. I was reading it and it was so vulnerable and powerful. And all of a sudden, like I liked you 10 million times more. I've always liked you, but I was, you know, a little intimidated by you. But I thought, oh, this explains so much. She's got such depth, and there's just there's so much in Kristen. So it actually made me really like, oh, I love her, you know. And I wonder if either now or in the next few minutes, I think it'd be really interesting. I know this is an essay question, but to explore how you went from that kick-ass, get things done on a mission, I'm going to run the ER, to now. I can just describe to you listeners, like you're kind of cracked open. You have a warmth and a softness that you didn't used to have. Like you have a gentleness and just like, you have a very different feel to you as a person. And I noticed that when we reconnected to start talking about this story, and it seems like it's not an accident that you're also doing private practice now, that you left the ER and running this big organization and all these employees. And here I'm sitting with you. I'm like, this is the same Kristen I used to know, but this is not the same Kristen I used to know.
Oh, talk about healing. Like that's what healing is, right? That's what recovery is. That's what coming into your own really is. I feel like a couple pre-COVID, I have a daughter, and I was having a lot of challenges with my parenting style and not being able to meet my daughter's needs in the way that my daughter really needed me to meet them. And even talking about this is so vulnerable. You know, I want to like project this image that like, oh yeah, like I've got my shit together and like I'm a good mom and all of that. And I do believe I'm a good mom, but I really, really struggled. And part of that was I was never taught parenting. I was never really modeled or shown how to be a good mom. So I was doing the very best that I could. But we were having some parenting struggles, and I sought out a therapist in the community that I knew had a lot of experience working with adolescents. And again, I was going in to talk about my daughter.
She's the problem.
She's the problem.
She's the problem. Yeah.
And all of her behavioral quote unquote issues.
Get her all fixed up.
That's right. This was not about me. And it felt so safe because it was about her. Like it wasn't about me. Like I was seeking help for my parenting, but again, this was about her. And this therapist was so amazing. And he sat with me and he listened to all of my troubles and stories about parenting and her behaviors and like all of this stuff. And eventually he said to me, well, when are we going to talk about you? And I was like, how dare you? This is not about me. And then like we really started to dig in and to figure out why I was parenting the way that I was. And I was so caught in my own trauma that I wasn't able to see what was really going on with my daughter. So here's the exact same thing that I needed my whole entire life. I needed somebody to see me. And my own trauma was preventing me from seeing her. So it was like he just slowly was able to like get in there with me and like really open that up. And this is also a very interesting point of this. He was the first male therapist I'd ever seen because, of course, I don't trust men. Mm-hmm. Like I've been violated by men and abused by men and all of this stuff. So to have a male therapist who was able to really sit with me and create this safe space and this container was an incredible experience. And slowly but surely, I started to open up to him and we started to get into all of the things that I thought I had, like, I dealt with that. Like, I've been in therapy for years. Like, I've done this. But he was able to open it in a whole different way and to really help me connect with what was going on with my daughter was actually not at all about her.
What?
Damn it. What? She wasn't the problem. I was the problem. And I'm so thankful because my work with him allowed for so much healing, and my relationship with my daughter is now so beautiful in a way that I never thought possible. And it's because I've been able to do my own healing. So he really helped me feel seen and feel like very understood. And I could say all of the things that I've hid from all of the other therapists I've seen. Like he was able to do that for me.
Yeah. What was it about him, or I don't know, the dynamic between you, or
mm-hmm.
like, what was the special sauce that, you've seen so many people,
right?
This guy.
Well, I think this is the first thing that comes to mind when you ask me that. When I would see female therapists, my own age especially, I'd want to be their friend.
Yeah.
Like, I want my therapist to like me, like I want to be their friend. And how true of that is our own clients. Like, they want us to like them. And of course I do. I love all my clients, but it is that, like, I didn't have that, like, I didn't necessarily want to be his friend. Like, I went to him for a specific purpose. You
didn't need him to like you or admire you.
Exactly.
Because he's a dude.
Right.
Yeah,
yes.
Dudes. Yeah.
This dudes, like men, whatever. So I think that was the first thing to begin with. Mm-hmm. I also knew that things were not going well in my life. Like, I needed to change, and I needed somebody to help me change the things that were really bothering me and that I was struggling with. And I remember there was one session, and he just asked me, and this is, I think, one of the things that made him so unique for me. He wasn't afraid to call me on my shit. Like, he absolutely would see me do something in session and he'd be like, what was that?
Wow.
What was this? And he said to me one day, he said, how often do you think you dissociate? And I was like, what? I'm like, never. I mean, I think I might have said, like, I don't know, every once in a while, whatever. When I'm driving to work, like, sometimes I'm like, oh, I forgot, how'd I get here? And he was like, you dissociate all the time. He said, I witness it almost every session when you're here. I see you leave the room. And I was like, but he said those magic words, I see you. And then I was like, oh, he sees me. So it's okay for me to now maybe own up to some of that and to do that.
Wow.
So he was really, he was with me through like parenting challenges. And then I was also working at another job where there was a lot of stress at that other job. And I realized that job wasn't the best fit for me. But again, like, I felt really stuck and I didn't know what to do. And he also said to me one day, he's like, why don't you go into private practice? And I was like, oh, I'm not good enough. Like, why would anybody want to come see me? Like, how would I help anybody?
Yeah.
And he just looked at me and he was like, Kristen, you know more about therapy than most people will ever know about therapy. You can do it. And I was like, okay, I'm going to do it. Yep. I'm going to leave this job that's toxic at this point in time and that I'm not functioning very well at anymore. And I'm going to do private practice. And I really think that was the game changer for me, and it finally started to feel like, oh, I'm really coming home to who I am. Like, I'm really getting back to my roots of why I wanted to go into mental health. I'm really getting back to what drove me. I want to help people. Like, I want to connect with people. I'm very relational now, which is so funny compared to, how you described me from earlier.
I mean, do you feel that? I mean, do you
100%.
Yeah. I mean, if I looked in a crystal ball and I could just 20 years ago and I could see you and me sitting here now and how you are. And I think, wow, it's astounding.
Yeah.
I mean, it's like you're the same person, but you're not
Yeah.
the same person.
And I really, really feel that.
Yeah.
And I think my relationship with him helped me get there. As a therapist, we want to think we have the answers or we know what we're doing, or I want to think I have the answers and I know what I'm doing. But I still get in my own way all the time, very much so. I just talked about, this therapist that was really a lifeline for me and truly helped me. I stopped seeing him. And I stopped seeing him because in my mind, this was before I was in private practice. I just said that, he helped me transition. But in my mind, oh my gosh, I'd been seeing him for 2 years. That's a long time. And he had to be getting sick of me. And he doesn't want to see me anymore. 2 years is a long time. So I need to tie everything up in a nice, pretty little package and move on because I don't want him to be tired of me.
Was there also a dynamic of you had shared so much with him? It's ooh, I need to close that up and seal it off because almost like a vulnerability hangover.
Yeah, absolutely. Absolutely. So now, I have gone back to therapy, not with him because I can't go back to him. That's my own dysfunction, right? But what he allowed me to do in that time with him has allowed me to come into therapy now as a whole different type of client where I can be vulnerable. I can share. I can talk. Which is very different than the therapist 10, 15 years ago. And I always say this for listeners who maybe aren't therapists, but I always say this. You'll know you have a really good therapist when your therapist is willing to be in therapy. Every good therapist should have their own therapist on speed dial because there's just so much. And there's so much that we hear and there's so much that we deal with, but there's also so much of our own life shit. So instead of being I can't let anybody know, it's now I'm yeah. I have my own therapist and she's amazing, so it's just this ongoing.
Yeah, absolutely.
A couple of years ago, there was still this part of me that I know, and as I've talked about already on this podcast, that felt very still broken. Still had this pathway in my brain that is the default pathway to all pathways of I'm not good enough, or somehow I'm a failure, or somehow, I'm not whatever, fill in the blank. There's all these words there. I knew that I wanted to really target that and I wanted to work on that. But as we've discussed, I've had years of therapy and it's still there. I still haven't been able to get past that. I've been learning a lot about ketamine. I remember actually Craig coming to a talk that we put on, this was years ago, even pre-COVID. And yeah, he talked about ketamine. And what you said at that time was doing ketamine is kind of like traveling down I-25. The highway that connects our city to Denver, the highway's I-25, and it's a gridlock traffic jam, all the time, avoided at all possible cost. But the analogy you used was putting ketamine as being on I-25, sprinkling a little of that down in that gridlock traffic, and then a lane just opens up and you can just drive straight through. And that stuck with me, and I remembered that. And so I started to learn a little bit more about ketamine. I started to see it advertised and I was I want to do this. I think that I want to try this and do this. So that was my first experience. And the profound healing that I got from my ketamine sessions was incredible and really did start to change some of those neural pathways. Really did start to help me alter that story that I had been telling myself forever. And I don't want to pretend that those thoughts never still come into my mind because 100%, I still have some of those very old story thoughts come in, but the difference is now I don't have to stay with them. So when I, hear the voice in my head go, oh God, you're such a failure, you're such a fuck up, or you're such a loser or whatever, I can be like, oh, isn't that interesting that that's here right now? I wonder what that is. And then I can move on from it, as opposed to spiraling and spiraling and spiraling and staying really stuck with it. So ketamine was kind of I'll call it the gateway drug.
Slippery slope, Kristen. Look out.
So then I was like, okay, I know what this has done for me. I need to be able to offer this to my clients. Like, if this can give me some healing, then I absolutely need to be trained. I need to really understand the mechanisms of these medicines so I can offer this to my clients in my own practice. So that's kind of what started me down this track, and I enrolled in a intensive training program and started doing more research and talking to people and really getting more experience with these different modalities. And then, of course, curiosity, like, I'm learning about all these things. Maybe I should try these things too. And I really do believe that psychedelic practitioners need to have an apprenticeship model of learning. Like, this is not some work that we can do because we took a class and we read a book. Like, you must experience psychedelics. And if not through your own experience of healing, but sitting with and really learning from teachers and people who have been doing this work and absorbing this. But, I'm an experiential learner. So if I'm an experiential learner, then I'm going to do the things too. And part of the training program that I was in, I just finished, they did require an experiential. Colorado is now pursuing the track to become licensed, to actually have a license to be able to do this work as well. So that was my first experience, aside from the ketamine, with some of these other medicines. And again...
With mushrooms?
Mm-hmm. Yeah. And again, the healing that I've gotten from some of these medicines has been really powerful. I'll just tell this one story because I think it just highlights the amazing power of these medicines. I went to a retreat, and it was a 2-night retreat, and we were doing medicine both nights. The first night of the medicine, I unfortunately have a really sensitive stomach and was pretty nauseous. So I was dealing with this nausea. I had ingested the medicine and didn't know what to expect and all of this stuff. And, I was basically on all fours, with my puke bucket in front of me and just fighting this urge to throw up, and felt really nauseous. And all of a sudden I looked up, and when I looked up, my 11-year-old self was standing right in front of me. And what she said to me, clear as day, just like you sitting here, what she said to me is, Kristen, we don't have to do this anymore. We don't have to throw up anymore. And it was like, oh my gosh, the nausea went away. I laid back down, and it was like she was there with me. And that was the healing that I really needed from her. It was like, yep, that served a purpose, but you don't have to do that. Mm-hmm. So it was like, okay, that was really powerful, right? Mm-hmm. And then night 2, again, because this was a 2-night medicine journey, night 2, I had that same experience of that, okay, here this is, here's what I'm going through, here's what I'm experiencing. And again, the power of the medicine, I looked up and I saw this other woman in the room with me. And she had this amazing presence, and I could tell she was an elder, and I could tell she was a healer. She comes over to me and she says to me, Kristen, I'm here. I'm with you. I've always been with you. And then I see her put her hand on my chest, and she melds into me as she says, Kristen, I am you. So it was in that moment, in that weekend, I was able to meet my 11-year-old self, who was so skilled at protecting us, saying, we don't need to do this anymore. You're okay. And then the next night I met this very wise woman part of me, this woman who was able to say, I've got you. I've always been here. We can do this. And it just was so profound and so oh, gosh, that's what I needed. I have everything I need in me already. And that's what I love about plant medicine, about these different medicines that we're using. So much of the belief behind it is we all have our own internal healer. We have everything that we need. We've always had everything that we need. We just need to be able to access it. And for some people, myself included, the medicine has helped me access those parts of myself that I didn't recognize for what they were.
Plus, I think these medicines allow us to have these really deep experiences, which is very different, than me saying, Kristen, you are loved. All these people love you. There's love all around you. But to be in a session, a psychedelic assisted session, where you feel it actually pour into your body and buzz in all your cells and lift you off the couch and envelop you. And that is a whole different deal than just someone saying you're loved.
Yeah, absolutely. And I think they could be so powerful, kind of going back to what you were saying about your perception of me or your view of me, from the days that we had first worked together. One of the things that you had said to me too was you just saw me as so serious. It's just, I was so serious all the time. And on one of these journeys that I was on, I think mushrooms can take on their own personalities and they can appear and they can talk to you in different ways and, all of this stuff. But in one of these journeys I was having, I just started giggling. I just couldn't stop giggling. And then there was another woman in the group with me and she started giggling. So then we had this giggle fest together. But it was the mushroom appeared and the mushroom said to me, be serious. Be serious. And the more that the mushroom was saying to me to be serious, the more I was laughing and I couldn't stop laughing. And, there was a voice in my head was be serious, be serious. This is time to be serious. And I finally had to say, fuck that. I hope I can say that on here.
You can say whatever you want.
Where I just wanted to be no, that's been the story of my life as I've had to be so serious. And I think that's what you're seeing now.
Yeah.
Well, I don't have to be serious.
I am absolutely sure that you've smiled more, broad, just twinkly smiles during this last hour than in the first, 15 years I knew you.
Yeah. Yeah.
If someone said, picture Kristen with a broad smile before, I know seriously, but I don't think she smiles much. She's too serious. She's got stuff to do and she's got to run these ERs and make shit happen.
Yeah.
But you're sitting here again. It's just, it's beautiful to see.
Yeah.
It's this just open, softer, kinder, loving, or even, and I'm so curious, how did you decide to reach out to me? Because I have to say, when I got your email, I was like, oh, Kristen. And I'm reading it. And so first of all, I was so blown away by your story and by how vulnerable that you just emailed me that out of the blue. And then I also thought, wow, how did you get to the point of, as you've described in this story, that most of your life doing everything you can to hide it, to deciding to contact me and put this out to, 80 countries all over the world and thousands of people.
Oh, a moment of weakness. No, a moment of insanity. No, I think there's a couple different things. The first is, of course, I'm listening to your podcast and just listening to all the very incredibly brave, courageous, strong people who have decided to share their story and the hope that I know that can give others, and I've heard a lot of people who have listened to your podcast say, oh my gosh, did you hear this one? I could relate to that. Or did you hear this one? And I think there's a part of me that knows that my story is powerful.
Definitely.
And I think there's a part of me that knows that me telling my story could also maybe one listener is out there who could be like, oh, I relate to that. I relate to that. So I think that was the draw.
And I think it's helping you.
Yeah.
I can just tell, just to sit with you as this unfolds. I'm thinking, because I want this to be therapeutic for storytellers too. I'm sitting here with you, listening, thinking, this is really good for you.
Yeah.
To just sit here with me, tell it, share it, and know that, that we're going to put it out in the world.
And I think that's a huge part of it is this is an owning of my story. So something that we haven't talked about, and I'll just touch on really, really quickly, is my truth is not believed. There's a really big struggle with this of, I've told people close to me, family members, about my story, and they flat out told me that is not correct. I don't believe you. Your memory is wrong. That didn't happen. I have one family member who told me that the person that I've identified as my primary abuser absolutely wasn't. It was somebody else. So there's a lot of this, we don't believe you. And that's coming from some family members. And for a long time, I struggled with that. Well, clearly, if they don't believe me, then I must be making it up. And how sick am I that I would make this up? That was a big part of that as well. So for me deciding to do this is owning that my reality is my reality, and my reality is my truth. And it's okay for me to speak my truth. Just because this family member doesn't believe me or denies what I say is a reality, that's about them. That's about their own reality. That's about the denial. That's about self-protection for them. But telling my story and starting to share who I am and talk about my struggles and all of that is really an ownership and an empowerment of this is who I am. And I'm okay with who I am. So much of what I talked about was in the beginning of the story is not being enough. And I now have a tattoo on my arm. The listeners can't see it, but it's of a goldfinch that just bring me so much joy. I love birds. But I also have the word enough on my tattoo. And when I asked the tattoo artist to put the word enough on there, it was as a reminder that I am enough, that I am good enough, I am smart enough, I am talented, all of that, like I am enough. But what I also realized after I had this on my body was I've had enough. I've had enough of people taking advantage of me. I've had enough of people not believing me. I've had enough of people telling me that I'm not good enough or I'm not worthwhile or I'm not anything like that. No, I've had enough. So not only am I good enough, but I've had enough. So telling this story and really taking ownership over it is reaffirming for myself and all of the parts of me that still struggle with that it stops now. Stops now. I'm here. I am who I am, and I'm good enough. I am enough. Yeah. Right now.
Amen, sister. How many people out there do we think we know? We have this whole story about them. We've sketched in the details, mostly unconsciously, to explain why we think they speak and act the way they do. And yet, if we had the patience and curiosity and grace to really see them, to truly know them, we would almost find that our initial perceptions and judgments had simply run through our particular and unique transference filters. We think we are experiencing other people accurately, when the truth is that we're typically only getting a little piece of the reality of someone, a little shard of their actual light that beams through the cloudy prisms of our transference templates. Today, I got to see and experience so much more of Kristen's actual light, and what a gift. And that's the gift of this work, getting to know people as they really are, as they truly are, and thus finding that common humanity and light and love.